Bonis, Spectrum Health United Memorial President. Can you give us an overview of the hospital expansion project that you just released today?
Well, good morning. We're very excited about it. I'd be happy to. You know, this hospital is a wonderful hospital, but it was originally built in 1952. And back in those days, the preponderance of care was inpatient based. And you know, so probably 80% of patients were inpatients, and maybe 20% were outpatients. Through technology, modern technology, advancements in medicine, new equipment, that trend is actually almost flip-flopped, whereas about 70–75% of our business is now outpatient. So if you will remember, back in 2005, we added the Hendrick and Gesina Meyer Surgery and Patient Care Center, which addressed our inpatient and surgical needs and made them state-of-the-art and beautiful facilities. This project is going to allow us to go through and do the same thing for our outpatient areas. It's going to impact our lobby. Our emergency room is going to get much bigger to accommodate the significant increase in volumes we've seen in the emergency room and also in outpatient. And it's really going to set the stage where 70% of our work now takes place in the outpatient setting. Those are all the areas of the hospital that we're going to renovate and add to and add additions to bring up to, you know, absolute state-of-the-art standard of care. So I think when this is done, virtually every clinical department where we take care of patients will be, since 2004, will either be completely renovated from the ground up or completely brand new. It'll be virtually a new hospital. So we're very excited about that, you know, and on the heels of being named a top 100 hospital, this just seems like the right thing to do to make sure that we continue to grow this hospital to meet the needs of the community and the surrounding communities, not only today but for generations to come.
Why are you going for the project right now?
I think, you know, there's no better, there's really no better time than when you really need it. And our volumes have increased so dramatically. Just to give you a perspective, in 2003 we were doing, that's about the time I arrived, so that's my perspective, we were doing about 12,500 visits a year in our emergency room. We're very close, probably not going to hit 30,000 this year, but we're going to be probably in excess of 28,000. That's a huge increase in volume in a pretty short amount of time. This emergency room and our outpatient facilities really aren't designed and don't have the capacity to accommodate that kind of growth. So, you know, what we hope to achieve is better efficiency, better patient safety. We're already ranked in the top 5% in the nation for quality, and we want to improve upon that, and these new facilities will allow us to get even better. I'd like to see us get in the top 1% in the nation for quality, because that's really what it's all about, and that's why people come to our hospital. And so, you know, we don't want to wait for that. We think patient safety and quality are job one, and this really can't wait. So that's why we're going to do the project now.
What aspect of the project excites you the most?
Gosh, you know, this has been years in the planning. I think it's like a domino effect. They all come together. So I'm excited about all of them. But I would guess, you know, the emergency room and diagnostic imaging obviously are really the two key areas. Our staff has done yeoman's work and just an absolutely wonderful job taking wonderful care of our patients in very small quarters not designed to handle as many patients as they're asked to handle. So, you know, ER and diagnostic imaging kind of go hand in hand, and I think those are the parts that I'm most excited about.